paranasal air sinuses. Let's break down the paranasal air sinuses, their anatomy, functions, and clinical relevance, all simplified and easy to understand.
Paranasal air sinuses. Paranasal air sinuses are air-containing cavities in the bones around the nasal cavity. Paranasal air sinuses develop as mucosal diverticula of the main nasal cavity, invading the adjacent bones. They are lined by a pseudo-stratified ciliated columnar epithelium. As in the nasal cavity, there are 4 paranasal air sinuses on each side and are named after the bones containing them. Frontal air sinuses present in the frontal bone. Ethmoidal air sinuses present in the ethmoid bone. Maxilla air sinuses present in maxilla. Sphenoidal air sinuses present in the sphenoid bone. Paranasal air sinuses are arranged in pairs, except the ethmoidal air sinuses, which are arranged in 3 groups: anterior, middle, and posterior on each side. The orbit of eye serves as a landmark to appreciate the location of various paranasal air sinuses. The relationship of the paranasal air sinuses to the orbit is the frontal air sinus above, the maxillary air sinus below, the ethmoidal air sinus medial to, and the sphenoidal air sinus behind the orbit. Functions. Paranasal air sinuses perform the following functions: make the skull lighter, add resonance to the voice, act as air conditioning chambers by adding humidity and temperature to the inspired air, aid in growth of facial skeleton after birth. Clinical aspect. Sinusitis. The infection of a paranasal air sinus is called sinusitis. Clinically, it presents as headache and persistent thick purulent discharge from the nose. In standard radiological images, normal paranasal air sinuses are radiolucent, whereas diseased paranasal sinuses show varying degrees of opacity. The newer imaging techniques, viz. CT scan, provides very clear images of the sinuses, which significantly aids in diagnosis. Classification. Clinically, the sinuses are divided into the following 2 main groups. Anterior group. It includes those sinuses which drain into the middle meatus, such as frontal, anterior, and middle ethmoidal, and maxillary sinuses. Posterior group. It includes those sinuses which do not drain into the middle meatus, that is, posterior ethmoidal and sphenoidal air sinuses. Frontal air sinuses. The frontal air sinuses, 2 in number, lies between the inner and outer tables of the frontal bone, deep to the medial part of the superciliary arch. They are triangular in shape. The right and left sinuses are usually unequal in size and rarely symmetrical. The right is frequently larger than the left and separated from it by a septum. Each sinus drains into the anterior part of the hiatus semilunaris of the middle meatus through frontonasal duct. Measurements. Vertical 3 cm, transverse 2.5 mm, anteroposterior 1.8 cm. Nerve supply. It is by supraorbital nerve. Clinical correlation. Frontal sinusitis. Infection of frontal air sinus may spread posteriorly into the anterior cranial fossa, causing frontal lobe abscess, or downwards into the orbit, leading to orbital cellulitis. The pain of frontal sinusitis is usually severe and localized over the affected sinus. Frontal headache. It shows characteristic periodicity, such as it starts on waking, gradually increases and reaches its peak by about midday, and then starts subsiding. It is also referred to as an office headache because of its presence during office hours. Maxillary sinus, antrum of Highmore. It is the largest of paranasal air sinuses and is present in the body of maxilla. It drains into the hiatus semilunaris, posterior part of the middle meatus. Measurements. Vertical 3.5 centimeters. Transverse 2.5 centimeters. Antero-posterior 3.25 centimeters. Shape. It is pyramidal in shape, with the base directed medially towards the lateral wall of the nose, and its apex laterally towards the zygomatic bone. Apex extends into the zygomatic process of maxilla. Anterior wall is formed by the anterior surface of the body of maxilla and is related to the infraorbital plexus of the nerves. Within this wall runs the anterior superior alveolar nerve in a curved bony canal called canalis sinuosus. Posterior wall is formed by the infratemporal surface of the maxilla, separating the sinus from the infratemporal and pterygopalatine fossae. It is pierced by the posterior superior alveolar nerves and vessels. Opening. Maxillary sinuses open in the hiatus semilunaris of middle meatus near the roof of the sinus. Arterial supply. It is by the anterior, middle, and posterior superior alveolar arteries from maxillary and infraorbital arteries. Lymphatic drainage. The sinus drains into submandibular lymph nodes. Nerve supply. Maxillary sinuses are supplied by the anterior, middle, and posterior superior alveolar nerves from the maxillary and infraorbital nerves. Clinical aspect. Maxillary sinusitis. Maxillary sinus is most commonly infected of all the sinuses due to the following reasons. Infections can reach into this sinus from infected nose, viral rhinitis, caries upper premolar and molar teeth, especially molars and anterior ethmoidal sinuses. Being the most dependent part, it acts as a secondary reservoir for pus from frontal air sinus through frontonasal duct and hiatus semilunaris. Pain of maxillary sinusitis is referred to the upper teeth and infraorbital skin due to common innervation by the maxillary nerve. Drainage of maxillary sinus. The opening of this sinus is unfortunately located in the upper part of the lateral wall of nose, which is a disadvantageous site for adequate natural drainage. Surgically, maxillary sinus is drained in the following two ways. Antral puncture, antrostomy, by using trocar and cannula, which are passed below in the inferior nasal concha in an outward and backward direction, fenestrating the antrum through canine fossa in the gingivolabial sulcus called Caldwell-Luck operation. Ethmoidal sinuses. The ethmoidal air sinuses are made up of a number of air cells present within the labyrinth of ethmoidal bone. Thus, they are located between the upper part of the lateral nasal wall and the orbit. They are divided into the following three groups. Anterior, consisting of up to 11 cells. Middle, consisting of 1 to 3, usually 3 cells. Posterior, consisting 1 to 7 cells. The first two groups, anterior and middle, drain into middle meatus. Anterior opens in the hiatus semilunaris and middle on the surface of bull ethmoidalis, and the posterior into the posterior part of the superior meatus. Clinical aspect. Ethmoidal sinusitis. It is often associated with infection of other sinuses. Pain is localized over the bridge of the nose, medial to the eye. Sphenoidal sinuses. The right and left sphenoidal sinuses lie within the body of the sphenoid bone, above and behind the nasal cavity. Measurements. Vertical 2 cm, transverse 1.5 cm, antero-posterior 2 cm. Clinical aspect. Sphenoidal sinusitis. Isolated sphenoidal sinusitis is rare. It is usually a part of pansinusitis or is associated with the infection of posterior ethmoidal sinuses. The infection of sphenoidal air sinuses spreading upwards may affect the pituitary gland and optic chiasma.
Like this quick explainer? Hit like, share, and subscribe for more bite-sized medical content. Thanks for watching